This recorded review will be going over MedSurg 2 Exam 6 Study Outline. This exam has two Select All That Apply questions. Testicular self-exams. Check out the green health promotion box on page 962. You can also read a little more on page 922. What levels of prevention are there and what falls into those levels of prevention? See page 914. Box 39.3. Medications for osteoporosis treatment on page 931. Familiarize yourself with the names of these drugs. Check out the green communication box about STIs on page 976. Know the signs and symptoms of candidiasis, page 968. Know the signs and symptoms of perimenopause, page 930. Also know the signs and symptoms of menopause on that same page. How is ovarian cancer diagnosed? Check out page 940. Herbs like St. John's wort can reduce the effectiveness of oral contraceptives. Also see the green health promotion box on page 932. Check out the red older adults care point box on page 930. Excessive uterine enlargement could indicate a hydatiform mole. Purpose and nursing implications of a colposcopy. See page 916, table 38.2. Know the signs and symptoms, treatment, and patient education for genital herpes on page 971. Diaphragm method of contraception. See this on table 38.1, page 912. You should know how to use this and how to educate patients on their use. Diaphragms would not be the best choice for a patient with multiple sex partners. What screening tests are used for syphilis? Check out page 974, table 41.1. The dorsal recumbent position is appropriate for administering vaginal medications, like cream. How should you educate a patient on performing a breast self-exam? Check out this on page 915. You should also know when and how to perform that, what time is best. There are multiple questions on this topic. Nursing Care Plan 39.1, Post-Hysterectomy Care, on page 936. Check out the different interventions and the nursing implications for this patient's care plan. You should also recommend that the patients use a tub bath instead of a shower postoperatively. Know the signs and symptoms of endometriosis, pages 935 to 938. Check out box 38.2 on page 918, Preparing a Woman for a Pelvic Exam. Look at the hormone therapy for menopause treatment on page 931. Estrogen can help prevent fractures due to osteoporosis. Methods of contraception on table 38.1. Look at the basal body temperature method. How does this work? Characteristics of testicular cancer and who is at risk for it, page 962. Oral contraceptives, table 38.1, page 913. How do they work? What are contraindications and who should not be taking oral contraceptives? If a pill is missed, you should educate the patient to take their missed dose with the next dose. Drugs used to treat BPH on page 957. Know the adverse effects of 5-alpha reductase inhibitors. Treatment for fibrocystic breast changes, page 941. Also know the signs and symptoms. Patients should be instructed to minimize their fat intake to help with symptoms. Look at the herbal therapy for BPH on page 957. Semen analysis for infertility. You can see more about this on page 923 and 954. Patients should abstain from ejaculation for 2 to 3 days prior to this test. Some PDE5 inhibitors can cause hypotension when taken with nitrates. An example of this is sildenafil. Read more on page 957. Reddening of scrotal skin is a change that is first noticed in puberty in male patients. Nursing interventions and education for HPV. See table 41.1, page 970. Look at box 41.2 on preventing STIs, page 977, and check out the green health promotion box on page 979.